Hello, my name is Jenna Shaw, and I'm currently a student in the Doctor of Occupational Therapy program at the University of Kansas Medical Center. Today, I will be talking about the potential benefits of recommending OT services to clients at the family place. First, I want to share some information regarding the role and value of occupational therapy, and then we will go into when a client may benefit from OT services, and then we'll talk about where a client could benefit from OT services within the Logan, Utah community. And lastly, we will talk about sensory processing in the OT perspective. As an occupational therapy practitioner, we help individuals achieve health and well being through engagement in occupations. Occupations are those activities that we do every day that give our lives meaning and purpose. And so, in summary, an occupational therapy practitioner helps people do the things they want and need to do. And some examples of these occupations include activities of daily living, such as getting dressed or grooming, going to the bathroom, life skills, health management, sleep, education, employment, play and leisure, and social activities. As an occupational therapy practitioner, we work with individuals, groups, and populations across all ages and stages of life. We work with those who could benefit from building skills, changing their environment, or making tasks easier. We empower people with a variety of diagnoses, and we often work with people who have had changes in their physical or mental health. Some examples of people that we work with are those who have experienced a surgery, an injury, or illness. We also work with people as they age, including people who have dementia. We work with those who have mental health diagnoses such as anxiety or depression, etc. And we also work with those who have had hand or shoulder injuries or developmental diagnoses, autism, Down syndrome, cerebral palsy, those who have sensory needs and preferences that are interrupting their daily activities. And then we also work with those who have experienced a traumatic brain injury, stroke, or other brain conditions. And so, as you can see here, there's a very large list of people and populations that we work with. And mainly, we work with individuals who are experiencing barriers in their daily routines or in their occupations. Occupational therapy practitioners work in many places. You may have seen us in a nursing home, a hospital, a school, at your home, a mental health facility, or within the community. This is one of my favorite quotes about occupational therapy. The actual doing of occupations is believed to be transformative, promoting adaptation, creating personal and social identities, connecting people to their communities, and enabling ongoing personal growth and development. As I've been an intern here at the Family Place over the past semester, I've seen a lot of these principles align with the constructs of occupational therapy. And I love this focus on connecting people to their communities. I feel like this value is very much embodied within the work that's done at the Family Place. The following is a visual representation of what we do as occupational therapy practitioners, and there are four parts to this. We assess the person, as well as their context. That's that little gray circle around the person. And then we look at the tasks that they're wanting to have completed or the things they're needing to do. Those are those little T's in the circle. And then lastly, we look at all of those items in order to determine where their capacity is at, where what are they able to perform. And those are that's that blue kind of cone shaped item that currently has a lot of those tasks involved. Maybe that person's able to complete several of those tasks, but we also can see that some tasks fall outside of what they're currently able to do. And so, our goal as an occupational therapy practitioner is to help people meet their needs and accomplish those tasks by building skills, changing the environment, or adjusting the tasks themselves so that all of these items are able to be completed, so that they can expand their capacity, so that we can expand that blue cone shape item there. And so to do this, we first look at the person. We assess their individual values, their interests, as well as their skills. And then we look at their environment and we look at their physical needs or their physical context within the environment, as well as their social context and their cultural context. What things are impacting them and what does their home setup look like? Things like that. And then we assess the task itself. We look at that occupation and we think about how that occupation could be adjusted to better meet the needs of the client. And so, in summary, we help build skills, we change the environment, or we adjust the task that's needing to be completed. There's also research to support the role of occupational therapy in community based mental health settings, and research shows that participating in meaningful occupations that result in positive emotions can help build resilience and fuel mental well being. Additionally, activity based interventions involving play, leisure, and recreation have been shown to help improve children's social interaction, self esteem, and positive feelings, and they also reduce behavior problems. So, there are many interventions within community based mental health that occupational therapy practitioners can be involved in. And so, at the individual level, we can help with skills training, compensatory strategies, and promoting healthy habits and routines to support wellness. We also work with community integration through recreation, leisure, or work, as well as sensory strategies. And we'll talk more about that later today. And then at the small group level, we can also run therapeutic groups to educate on or promote engagement in occupations. So, back to those examples of leisure, sleep, healthy eating, exercise, life skills. And we also can focus on self regulation, and we use zones of regulation quite frequently to teach that. And then at the system level, we can also focus on environmental modifications or sensory friendly environments, which we will talk about later today, as well as lifestyle redesign at the individual, group, or system level. And while occupational therapy has many different settings that we work in, there are specific focuses on mental health within each of these settings. And so I won't get too in the weeds here with this chart or anything, but feel free to pause it and take a look at some of the settings that we work in, as well as specific focuses on mental health that we have. And so next, I want to jump in when a client at the family place could benefit from OT services and where we could refer them to. And for the next couple of slides in this presentation, I will be referencing some of these self referral forms and resources that I've created to help the family place in recommending clients to OT services when needed. And so, as you can see here, there is a form for pediatric clients as well as adults. And so, each of these forms focuses on occupations that are specific to both kids and then adults. And so, the next couple of slides, we're going to go through some specific occupations that occupational therapy practitioners can focus on that might be seen with clients at the family place. And so, to reiterate, the biggest thing we're looking for when we're recommending someone to OT services is if their occupations or daily activities are being negatively impacted by something. And so, with kiddos here, I have several examples of things, and I just want to make sure it's very clear that just because a child has a certain diagnosis or something like that, it doesn't automatically mean they need OT services. They might be managing their diagnoses very well and they might be thriving and they might not need OT at that moment. And so OT steps in when there is a barrier to those occupations. And so with kiddos, I have the first part talks about some fine motor or kind of those handheld activities using buttons, zippers, shoelaces, coloring, drawing, tracing, handwriting, using scissors. And so if these occupations or these tasks are not able to be completed, that could be interrupting school activities or daily tasks. And one thing that's important to remember is that when we're recommending two occupational therapy services, we always want to make sure that we are recommending within the appropriate developmental milestones and ages for those different occupations. And so, the next part, balance or going up and down the stairs, that could be impacting several things. But yeah, OT can talk or can help with things like that. Gross motor is what we call it. And then you see eating here. So picky eating or difficulty with food textures, that's part of that sensory component that OT focuses on quite a bit. Daytime bathroom accidents after the age of 6, getting restful sleep, understanding and responding to emotions, whether it's at the home, grocery store, playground, school, or community. And this aligns very well with what the family place already does with emotional regulation and things like that. And the occupational therapy perspective just adds another lens to it. There's a lot of overlap in the way we approach situations like that as well. And so that goes into the not able to calm self when upset, overly sensitive to sound, touch, or movement. That again touches on that sensory component. Responding to sensory input. Maybe someone does not respond to their name, they're bumping into objects frequently. Again, those are those sensory aspects. And then transitions, finishing play to start a meal, focusing at school or following directions, playing with friends, or playing with others, or making friends, or playing independently. And so, okay, that's a very large list. And just again, I want to touch on each of these, check boxes here. There isn't a certain number that need to be selected to recommend occupational therapy services. OT is definitely warranted if any of these items here are making a significant amount of impact on a family's well-being, or the daily life and daily tasks or daily routines of the child or with the family. And next, to focus on adults here, this is very similar in the structure to the pediatric referral form. The biggest thing here is, well, as we talk about each of these items again, we want to make sure we are recommending clients who are experiencing an impact with those occupations. And you can see here on this side, I've got items listed that are adult occupations. So, daily tasks again, or life skills. And by that, I mean like finance, managing a home, things like that, health, sleep, education, employment, and hobbies. And so, some examples of things that we can help with as occupational therapy practitioners are doing daily tasks such as bathing, toileting, dressing, or eating. And we can also help with providing strategies to caregivers of individuals who are struggling with those daily tasks. For example, if an individual has a diagnosis of dementia, they might be experiencing a lot of difficulty with those tasks, and an OT could come in and help with training the caregiver as well as the client to help with completing some of those items and making their environment a little bit easier for completing those tasks. And so moving down the line, we have keeping a budget, preparing meals, grocery shopping, getting around in the community, eating healthy foods and exercising, activities that involve planning, problem solving, or memory, organizing medications, managing pain, getting restful sleep, staying in school, finding or doing hobbies. And so, again, with each of these things, occupational therapy specifically can address these items. And there are many great resources in our community that OT is a part of, in which individuals can go to when they're needing help with these items. And so on the back of each of these forms, I have some services listed. And this example here has both of those pediatric and adult forms combined just for ease. But with each of those forms, I'll send them out in PDFs. They're able to be seen, a list of pediatric sites and then a list of adult sites as well. I specifically want to touch on the Salt Lake Community College Physical Therapy and Occupational Therapy Pro Bono Telehealth Clinic. And so this clinic is completely remote. Well, there is an in person clinic if you're in the Salt Lake area, but for our clients who are living in the Logan area, you do need to be on a computer within Utah during those sessions. But these are completely free services, and they're provided 45-minute sessions once a week for 10 weeks during the fall and spring academic semesters. And so we can reach out to this email here for further questions about this. And also, if you need services provided in Spanish, they can do that with select cases. And so reaching out ahead of time is great there. And so this site does provide services for all children and adults who are in need of services. There's no doctor's orders needed, no insurance needed, and insurance isn't even accepted here. It's all just come as you are, and they don't ask any questions. They accept all individuals regardless of citizenship or immigration status.